My lowest recorded weight. My lowest recorded weight was 10 pounds lighter than when I started medical school. As my BMI approached 17.5, I stopped weighing myself, not wanting to see a number that I felt like I had no control over. Rounding with the child psychiatry team one day, I looked at the wrists of a 15-year-old with anorexia nervosa and stole glances at my own wrists, disguised under sleeves of 2 large white coats, and looked at how the bones in my skin poked out in the same way that his did. I went home and I thought I should inspect my skin for lanugo, and I looked in the mirror and marveled sickeningly at how I could see my uppermost ribs in the mirror, my skin slithering over them as I moved my arm. I should volunteer as a model for anatomical landmarks, I thought wryly. And doctors apparently agreed. One of our lecturers used my sharply boned scapula to demonstrate how to do an upper body exam. The phrase unintentional weight loss felt overly dramatic. Surely if I was becoming cachectic, one of the many doctors surrounding me would have made a comment. My weight dropped down slowly at first as I began medical school, and then more rapidly as a series of unfortunate personal circumstances hit. I mourned the loss of one beloved dog while nursing my family's other dog through his final months of life, coaxing him with every possible delicacy until finally feeding him with a syringe as his cancer consumed him. Each loss felt like an indigestible stone in the center of my abdomen. 2 or 3 bites of food, and I felt like I had gorged myself. On my worst days, eating any more than that left me nauseated. My appetite had only barely begun to return towards the beginning of the pandemic, and at that point, any hunger for food was outcompeted by my insatiable fear and isolation. When I was 5 pounds down, over a year in, my mom convinced me to get a medical workup. So I dutifully presented my HPI and allowed the doctor to run lab work, all of which came back normal. I hinted that anxiety was at the top of my differential, and she told me that that was a diagnosis of exclusion. Soon, I became a master in the non-compliant patient, taking months to schedule the CT that had been ordered and then never following up after the test came back clear. At which point, I'm pretty sure I was marked as lost to follow-up in my doctor's chart. I don't know, at some point, I was laying on the CT scan table, terrified that I was going to become some poster child for some rare gastric cancer, like, get tested today, if only I had seen my doctor sooner. And the technician asked me why I was there and laughed at my response. Honey, she said, when you get to be my age, you're gonna be dying to have that problem. Shortly before I hit my lowest weight, the anxiety and depression that had been incubating in my epigastric region, announced itself more overtly, exacerbated by the dissipation of my closest friendship. I had kind of hoped that I could get some relief from hospitalization and rest with the strange fantasy that someone would tube feed me back to a healthy weight. But once my ability to focus on my work and all of that began to suffer, I finally got the motivation to stop waiting for such a dramatic intervention, and I scheduled an urgent therapy session the night before my psychiatry rotation began. I talked for an hour about my lack of concentration, only to hit that poor woman with the most masterfully understated, "I'm having trouble eating," when she asked if there was anything more that I wanted to discuss. She was passionate about microbiome nutrition, so she regaled me with theories that assumed a lot more appetite than I had to work with. Hoping for some relief from the depression that was screaming at me from the PHQ-9s that I had been self-administering, I began regular therapy. And that limped on bi-weekly and helped with my concentration and my interest in activities, but left my appetite stubbornly untouched. The first time that I was hungry again was actually in the hospital on my peds rotation. I had grown accustomed to scraping by for calories and forgetting to pack lunches knowing that I wasn't going to be able to eat it regardless. But at some point, the distraction of patients and the endless parade through hallways unexpectedly cleared the way for my appetite to break through that gnawing pain in my stomach. Surreptitiously, I bought lunches at the hospital cafeteria, and I felt giddy snacking on food that kind residents had brought in, and like I was some mischievous child sneaking cookies while my disease's back was turned. It is strange how I vividly remember every pound and every accompanying worry, and yet how sporadic and vague my memory of most of my recovery is. I saw each number on the scale spelled out in medical jargon, my body subjected to my anxious mind and the knowledge that I had gained in school learning about how to help others. I thought about reef feeding syndrome and how my elusive recovery could even hold danger and disease of its own. I wondered if, when I actually had the capacity to eat, would I have to ration myself or risk metabolic derangements? When the psychiatry team was talking about ideal calorie counts for that skinny-wristed 15-year-old, a lot of my interest was on my own behalf. But all at once, the medical terminology that had become the language of my anxiety was absorbed by rounds and charts and teaching, and my anxiety was seemingly left mute. The stories that I think about now are, the stories of my patients. I set out to tell a story about my recovery, but I find that health has made me a poor historian. When I could not eat, my mind was filled with expectations and outcomes and risks. But when my starvation ended, I wasn't thinking of my own stomach or electrolyte levels. I simply ate.